And when I went to this new GP in February, I went to someone who knew nothing about our background in a different town and only told them the symptoms. I kept the mental health and the trauma out of it, and I was given the tests that I needed. And within a month, I was actually booked in for a full hysterectomy because they were so concerned about the chance of uterine cancer.
Welcome back to the You Need a Counselor podcast. This is a show presented by Heart and Solutions Counseling Agency. We release new episodes every Sunday at 5 p.m. Central and encourage you to batch up that laundry, put away the dishes, plan for the week ahead, or do any other task that might seem daunting while you give our show a listen. You might just be encouraged to call your therapist, connect with this week's guest, or seek out those services you've been considering for a while but haven't made the commitment to yet. If you are in the state of Iowa and are in need of mental or behavioral health counseling, give us a call at 1-800-531-4236. Enjoy the show.
Hello, and welcome back to the You Need a Counselor podcast. My name is Dr. Julie Johnson. I'm the president and founder here at Heart and Solutions, Mental Health Counseling and Behavioral Health Counseling in Iowa.
And I'm Chrissa Hunt. I am our vice president in charge of the behavioral health department. And this is our podcast, You Need a Counselor. So we are designed for people curious about counseling, but have barriers keeping them from experiencing the benefits of counseling. Our mission is to share stories about counseling, good, bad, and indifferent, and spread the message that everyone can benefit from mental health and behavioral health counseling services.
Our guest today joins us in the middle of the night where she is from the other side of the world. We've got Margo Priestly here with us today. Margo is the founder of Hush Hormone, which is a wellness group and a wellness brand that helps people to process through being situations where they've maybe experienced trauma, they've maybe experienced misdiagnosis, and able to bring her story and the things that she has personally experienced in the mental health field to others and help support them through that journey. Margo is also a medical researcher and utilizes that background with Hush Hormone. So welcome, Margo. Thanks for being here.
Thank you so much for having me.
Now, okay, so tell us about Hush Hormones and what kinds of services that you help people with.
Okay, so predominantly we're about helping women with hormonal issues and helping them while they're navigating. It can take 7 to 10 years to get a diagnosis for a hormonal issue, whether that be PCOS, endometriosis, adenomyosis, and a plethora of other conditions similar to those ones. And whilst us as women, we know that there's something wrong and that we'll have ongoing health issues, but we'll go and see our GPs, our doctors, and they'll tell us that we're overworked, too many kids, that's a big one. Yeah, of course you're tired, you've got way too many children, and it's not normal. These things aren't normal. So even for myself, I worked in the medical field for many, many years in medical research, and that was always what I was being told. So I started researching for myself and created some beautiful products that actually can support you throughout that phase while you're searching for a diagnosis, basically, and other resources to assist women in those areas.
I'd love to hear your personal story too of like what happened with you and how that led you to create Hush Hormones.
Are we all prepared for that? Because that is a big one. There's a few bomb drops in this one. So back in 2013, my husband and I, we just had our first child together. We'd both been married previously, so we had children from our previous marriages. Our little boy was actually born 10 weeks prematurely, and we just brought him home from the hospital. And 2 weeks later, we got a phone call from my husband's ex-wife telling us that her fiance had actually been murdered in the house and we needed to go and pick the children up. And the children would have been 3 and around 5 or 6, 2 young girls. So we needed to go and collect them, and a day or two later we had the police, all the investigative team, everyone at our house, a Sunday morning, just finished cooking breakfast, looking after everyone, and they told us that actually they knew who'd committed this atrocious crime, but they couldn't tell us anything. And their advice to us was to disappear for as long as it took them to make an arrest. So we had two young girls who were extremely traumatized, having lost their stepfather, who they'd lived with for a number of years earlier, an extremely premature baby who we still were seeking a lot of healthcare for, and my three children from my previous marriage. So we spent 7 weeks living out of the boot of our car, stopping for me to express milk at truck stops for the baby. So yeah, it was pretty wild. And when I went back, after an arrest was made and we were told, okay, you can come back to the area now, like you're safe to return to your hometown. My GP, who has been our family GP for that entire time, and even since then, up until February of this year, and he's a great guy. We've had a really wonderful relationship. Unfortunately, because of our situation and the huge amount of trauma that it brought with it, it led to me being constantly misdiagnosed for over a decade. So every time I had a symptom, I was told, and there's a lot of literature out there, you know, like books like Your Body Keeps the Score and all of these other resources that say trauma causes pain, trauma causes anxiety, trauma causes depression. So every symptom I had wasn't properly investigated. And I knew there was more because I felt that I had processed my trauma quite well.
Yeah, I'm interested in how you knew that there was more, because I'm listening to this and I'm going, how frequently does this happen to people where they're going to their general practitioners and saying, okay, I'm having symptoms. I don't feel myself. I'm feeling tired. I'm feeling this. And they're told, well, of course you are, right? Of course you are, because of some other thing that may have happened.
Yeah, so I recently started using the term trauma-focused or trauma-directed care, as opposed to trauma-informed care. And I feel like that is the care model that I ended up falling into and a lot of other people do fall into. And the way I differentiate that is you have trauma-informed care, where a doctor will look at you and look at your symptoms and treat the symptoms while supporting the trauma. And trauma-directed care is where everything is viewed through the lens of that trauma that you've had and pulled back to that. So I knew there was something more when I really started doing my own research, because I just knew something was wrong, and it was more than that, because they kept trying to diagnose me with depression, and I kept saying to my GP and my psychiatrist, because I do have a treating psychiatrist, then if I have depression, I must be the happiest depressed person you're ever going to meet and the most positive depressed person you're ever going to meet. So it didn't fit with what I had read. And having worked in research, I had access to a heap of literature through different resources. And I started to look at hormones as the crux of it all. When I looked back at my medical records for my son, who I mentioned previously, he was born 10 weeks prematurely. So what I looked at was I actually had to be on progesterone suppositories through the entire pregnancy. So they put me on those around 12 weeks when I was 12 weeks pregnant. And I hadn't thought about this in years. And still they didn't work, obviously, because he was still born early. So I didn't have enough progesterone to sustain the pregnancy to term. But when I got access to my blood work, which was at the beginning of this year, so I'm not sure what the US system's like, but often we don't, over here in Australia, we don't necessarily get our records. We're not trusted with them because we don't have a medical background, so they could be misinterpreted or things like that. But because I've had this good relationship with my doctors and I had a professional relationship as well, I was able to get all of my blood work. And I noticed that consistently throughout this decade-long history that I had, my progesterone and estrogen were always out of balance. So my estrogen was always off the charts, and sometimes my estrogen was as low as 1. So I had no progesterone balancing that extremely high levels of estrogen. And when I looked into that further, estrogen can drive depression and anxiety, which I'd been diagnosed with generalized anxiety. But in fact, it was an overload of estrogen without that progesterone. So when we started looking at that, I actually went, I need a new GP. And when I went to this new GP in February, I went to someone who knew nothing about our background in a different town and only told them the symptoms. I kept the mental health and the trauma out of it, and I was given the tests that I needed. And within a month, I was actually booked in for a full hysterectomy because they were so concerned about the chance of uterine cancer due to the estrogen level. I had a thickened uterine wall that was heavily indicative of uterine cancer, and a few other little issues going on as well. And since then, I've never felt better. So...
Which is crazy because, yeah, if you hadn't sought out a different doctor, like you would have potentially never caught that. How did you keep trying and trying to get your blood work done, figure out what was wrong with them telling you it was mental, and you were like, no, this is physical? If someone's listening and they're like, okay, that's happening to me too, how did you keep trying and get that tested to figure it out?
Well, and I think we all fall into that kind of place of complacency or comfortable, we become comfortable. So I had stuck with my GP because I had a personal relationship with them and because I felt comfortable to talk to them. But now in hindsight, I realize that I probably should have left a long time earlier. I could have still maintained that personal relationship and the professional relationship. Because, and the reason I say this is because whenever I'd go there with a new lot of symptoms, I was probably being told it's all in your head, but in a very, very polite way, in a loving, caring way. But that was the messaging that kept coming through, and I wasn't prepared to deal with that. And I think since I've realized this, I've been on a lot of different social media, TikTok. If you're on TikTok, there's just thousands and thousands of women who have had that same experience where they're just misdiagnosed for whatever reason, but for decades. And it's really, really scary. It's kind of like we've just moved on from the hysteria diagnosis into the tiredness or the overworked or that it's all in your head, and we haven't moved on from that. And I mentioned that I do have a psychiatrist because one of the diagnoses I was given was generalized anxiety disorder. So I have seen the same psychiatrist for around 2 years, and he went through the normal list of different medications for anxiety, and it was resistant. My anxiety was resistant to every single medication option that he tried. And it was irrational anxiety. So I was able to identify that I knew that what I was thinking was not a rational thought, but my body couldn't keep up with that. So I had physical symptoms rather than a feeling of feeling concerned about something. I actually had physical symptoms where my heart would be racing, hands sweaty, that feeling in the chest, not being able to breathe. And now, again, when I look at this with the hormonal symptoms, they tick every single box of what these hormonal symptoms should have been. So even there, and he has been really supportive of me chasing down a diagnosis, and he's actually been proactive in me receiving the correct care, because after I think we tried about the 6 different anxiety medication, even he was like, I'm stumped. You don't present with the way I would expect, and something should have worked.
Wow. And I mean, good for you for going through, and good for your psychiatrist for being open to going through that trial and error process that is psychiatry. I mean, it is, like you said, that long list and those trial periods and going, okay, I'm going to take this for this long. And how do I feel? Do I feel any different or not? And then, okay, let's try this other one. Let's see if this combination works. And that can be such a trying experience for so many people of just feeling like, well, I have some hope, and then I don't have hope in that anymore. And now I have some hope, and then I don't have that anymore. How did you get through and push through all of those different trials to get to the end to be able to say, okay, none of these worked, but I know that I gave them each a fair shot?
Yeah, I'm really lucky. And as you ladies are both aware, my husband got up at 2 a.m. with me to help me get this set up. So I've had a really good support system. So I'd come home all the time from these appointments just in tears, because I'd be like, oh, why do I feel like there's something wrong with me? And they're telling me that there's nothing. And, I just need more rest. And I'm like, how much more can I rest? There's just nothing's working. And I have to credit my psychiatrist, because no matter how wild the research papers were that I would bring in to him, never once did he dismiss them or feel challenged by that. And I think finding a professional that's open to receiving feedback, that can be tricky, but that's actually crucial. And it also assists with the patient rapport, to have that, to be able to go, I know that I can take this information. I'm not going to be belittled or made feel silly. And which is another thing I read constantly, is that patients are being laughed at in GPs' rooms or in psychiatrists' rooms, because they'll go in and say, hey, I've seen this new research that's just come out. Do you think that fits with me? So having that kind of connection, I think, is really important. And just finding someone that you really gel with, and not being scared to go, this isn't my person, I need to find someone new. I have walked out of appointments before where I've just left it in a good way. But I've just said to them, look, I really thank you for your time, but you're not the practitioner for me, and moved on.
So how did you go from finding out what was wrong with you to making Hush Hormones, and where did that process start, and you decided that you wanted to start helping other people too?
Oh, so this started a while ago. So I knew I started to diarize and track all of my symptoms. And I then started to track what I was eating, what I was drinking, what I was putting on my body. And I started to see patterns. And I started making products for myself. I do have a small laboratory set up in my house. So I was like just tweaking stuff, making stuff. And then one of my favorite products that I have is actually a functional chocolate. And this came about because I knew magnesium really helped me with my symptoms. Raspberry leaf was really helping me with my symptoms. And I have a son who it's really hard to get him to sleep. So magnesium helps sleep. And I went, well, what if I put it in his chocolate? So I started making it, and it was actually phenomenal. It was really, really good. So that was how that started and came about. it was over a few years of development. And then a few friends and family started going, hey, can I get that? Because it's really working very well. And then I just started writing some resources and things like that and popping them up so that people had access to be able to go, you know what, I've got a few funny symptoms, and even around about questions to ask your healthcare team, like about treatment options, and even down to how do you word this so that they don't feel challenged or like you're trying to self-diagnose, because there are those out there that still, don't like patients coming in and say, hey, I think this is what's wrong with me. So how do you convey that information to them or ask for those tests in a way that's going to be heard and respected and acted on? But yeah, so to answer your question simply, started it for myself many years ago, and it was a work in progress, and I just kept tweaking and tweaking. And then when I had my surgery on the 26th of May this year, I obviously couldn't work for a while. So I went, you know what, I'm just going to go all in. I can't leave my bed for at least the next 6 weeks. And I just created and created and created, and it's just really started to take off from there.
Yeah, magnesium, I have to say, I have a kind of a odd situation with it, because we had gone to this craft fair, and my daughter was like, smelled it and was obsessed and wanted this like spray that you were supposed to put on your feet at night to be able to sleep. And
Yes.
She wanted it so bad. And so I said, okay, we'll get it. And then she'd never put it on her feet at night. And so I said, well, I don't want to throw this away. So I'm going to start putting it on anytime I put my shoes on, because I could not remember to put it on at night. But it said, anytime I put my shoes on, I'm going to put it on, and then I'm going to put my sock on, and then I'm going to put my shoe on. And that was excellent. I really enjoyed that.
Yes, and this is it. When we have to take something else or do something else, it's about that memory, and it's trying to find, well, how does this fit into my day? And if it doesn't fit in a way that is easy and memorable, then it's another chore. And
yes.
Working mums, if you've got kids, you're already doing all the mental load, you're looking after the family, you're managing everything. You don't need another thing to add on to your to-do list. You just want something that's just for you. Sit down, have a coffee, eat a chocolate, go to sleep.
That's right. So I love your idea of magnesium chocolate, because it felt like a struggle, trying to, okay, put this on your feet and then lay them still so you're not having them all over the bed, right? And all of that. And so we had to attach it to a different habit. Like, okay, I'm going to put on my shoes almost every day. So that's when we're going to do it. And so I think that the chocolate situation really, really does help with that, because it's not a new habit that we have to build. We're going to have snacks. We're going to have a treat throughout the day.
Exactly. And why shouldn't our self-care feel a little bit beautiful and a little bit cheeky and a little bit luxurious? Like, it doesn't always have to feel like that clinical kind of care model.
Absolutely. So you mentioned some of the physical symptoms that you were having at the time, the racing heart, the difficulty breathing, that feeling of like the walls closing in. A lot of people will experience. And my husband has had very, very high estrogen. And it caused a lot of these kinds of symptoms for him as well. And he would take these anxiety medications, and he'd have these horrible symptoms right at night, and these terrible nightmares, and this terrible, sleepwalking, and all of these things that would happen as side effects. And then started testosterone cream and injections, and it just changed so many things for him. And at the time, one of the symptoms he was having was weight gain, and kind of dramatic weight gain at one time. And also, on a male body, they say that where you gain the weight, right? So in that stomach, abdomen area, and around the hips, it can sometimes be an indicator, right, that it might be a hormonal imbalance or low testosterone. And so he was having that. And when he first brought it up, he was also told, like, well, you're getting older, right? You're in your 40s now. You're not running track all day anymore, right? And so I think that not only women but also men are told these things of like, well, yeah, of course, you have a young child and you're working full time. Like, of course you're going to be tired, and of course you're going to gain weight. That's just what happens to us as we get older, and those things can just feel so dismissive when we hear them. And especially when we're hearing it from a medical provider who is trained and that we trust. I mean, you described a very similar situation that we had, which is we had this medical provider for a very long time, and we did trust him, and we do trust him, and so that puts kind of that extra edge on it, where it's more difficult to say like, no, I don't think that this is just weight gain from being 45 now. I don't think that this is just being tired because everybody's overwhelmed. And that, what a challenging thing to do. And so I love that you're sharing this message, and also those scripts of what to say, how to say it, because so many people don't say it because they're like, I don't want to upset my doctor, right? I don't want to ruin this.
Or BC is the problem patient.
Yes, absolutely. Absolutely. And so I love that you got access to your own blood work. And here in the United States, I'm seeing more and more the patient charts where we're able to log into a portal and we're able to see our own, because I have fatty liver disease. And so I'm able to see my liver enzyme tests from year to year to year to year, and my vitamin D deficiency levels, right, from year to year to year. And it is so interesting to be able to see that, like, okay, we upped that vitamin D dosage on this day, and then this is what my levels did when it was checked in 3 months, when it was checked in 6 months. And that information, just having that, is so empowering for so many people. And I want to echo that get our own, let's get our own records.
Yeah. And
we can give context to them.
And look, there is definitely a lot to be said for lifestyle factors. So I'm not ignoring that. But I think that once we've tried them, doctors need to listen a little more when we're saying, I've cut out alcohol, I've cut out soft drink, I've tried this, I eat these foods, because I think there's always that element where they just don't really believe that you've done that if you're not seeing those changes. So interestingly, you just mentioned your liver. So that was one of my symptoms as well, was my elevated liver enzymes. And when I was doing that research, your estrogen is actually processed via the liver. So if your liver's sluggish, which mine was, and I'm not saying this is the same for you, but just how the whole body is interconnected. So my liver was already struggling because I had that, and I kept getting told, well, just stop drinking. And I kept saying, I haven't drunk since I was 21. So I don't drink. Like, I don't know what else you want me to give up. But it was struggling because my estrogen was so high and it just couldn't process that one extra thing. So then I discovered about there's a product that it's abbreviated to DIM, DIM. I'm not going to try and pronounce the technical name here this morning, way too early in the morning for that. But it's really, really good at processing that excess estrogen and helping take load off the liver. And it's really easily found, guys. It's in broccoli and Brussels sprouts and all your greens. But over the years, our diets have changed. Hence why I said I do think there's a lot to say about those things. But doctors aren't giving us this information. It's either it's all in your head, or take this pill and then your liver's under extra strain, rather than going, okay, well, these products actually have this, and that's, I do actually have a product that has that DIM in it, and it's, a lot of it is from your broccoli sprouts and all of these other things, and it's in a powdered form. And again, it's not a substitute for a medical treatment, but it supports that liver clearing process while you're finding your treatment. And that's what we are all about. It's not to fix the problem or to, take place of your medical treatment. It's all about supporting you during that difficult time while you get your correct diagnosis and build a supportive healthcare team around you.
And out there where you live, do you find that there's so much push for prescription medication and that, healthcare providers are not prescribing broccoli, right? Broccoli sprouts.
Right.
Because there's no money in broccoli sprouts.
Well, we've actually swung the other direction now. So we have the TGA, which I think is similar to your FDA. And we're constantly, like, we can't even buy paracetamol. I think you call that acetaminophen, painkiller.
Yeah, just like Tylenol.
Basic. Yes, Tylenol. Yes. So we don't have, it's a different thing over here. We call it paracetamol or Panadol. So it's been restricted again just recently. So box sizes will only be available in packs of 8. And that's what you can buy. So we are so restricted. So you go to a GP, and even when you're reading about women who have got stage 4 severe endometriosis that's grown into their lungs and their spine and their liver, and they're being told period pain, it's normal, deal with it, move on with life. They can't get proper pain medication because the TGA has just went from one extreme all the way over to here now. And they're basing their information on really outdated data sources. So there has to be better ways to support women. And unless we all really start to make some noise about it, it's not going to change. So we have to be vocal. We have to talk about it. We have to push harder for our own healthcare. Because you basically, in Australia, you walk into a GP. I think they have it's billed in 8 or 15-minute blocks. So you get to walk in, go, this is what's happening. And then they're like, okay, well, here's a referral for this, or here's a script for whatever it might be. And that's it. But you don't get time to go through everything, all the symptoms that if they looked at you from I don't really want to use the word holistic, but probably as a people-centered, like a personal approach, and looked at you as a whole person and went, okay, well, how is your sleep? How is your diet? How is your anxiety? How is your depression? And if they could link it all together, because it's like a big jigsaw puzzle, really, isn't it? And it can take that 10 years for all those puzzle pieces to come together until they've finally got the whole picture and they can go, aha, this is where we are and this is what's going on with you. But it shouldn't take that long.
Yeah, that's interesting that like you had to go to a doctor then to even get some type of medicine if you can't even purchase Tylenol. And it kind of makes sense of how it took like that long to get a diagnosis and to get your surgery because if you're only scheduled for 8 minutes, you don't really have that much time to explain any of your symptoms. That is interesting. When I see you mentioned you also had a good and bad therapy experience as well. Can you kind of go into that? And I mean, it sounds similar to where you had to like try different therapists to find something that worked for you and your family in that situation too.
Yeah, and I think that just to reiterate, it is about finding that perfect match. There's someone out there for every one of us, isn't there? And the same can be said with therapy. So I'd seen therapists over the years for different things. I've seen faith-based therapists. I wouldn't necessarily say that I particularly am for or against that, but I found it really comforting in times when I needed it. But after the murder that happened back in 2013, we knew we were going to need a lot of wraparound services for the children. Our initial focus was on supporting them through that. So I actually looked and found a really highly recommended child trauma therapist. We travelled an hour to go and see this person. And first meeting was just with myself and my husband, went really, really well. We felt really comfortable with the second and third were with the children. And then we went back. So this was all over the space of about 1 to 2 weeks, very, very early on. We went back and it must have actually been just, it's a long time ago. So it wasn't directly after, because we were still in that travel period, but after the girl's mother was arrested and incarcerated, that was when we started seeking this service out. And we also had to go through the family law court to try and secure legal custody. So that's not automatically granted if a parent is incarcerated. So you still have to go through that legal process. So we needed support from that counsellor. And then when we went back that last time, her whole attitude had changed and her language was different, her body language was different. And I really pick up on those kind of things, and I just felt really uncomfortable. And so I just asked her straight out, like, what is going on? And we ended up finding out that the girl's maternal grandmother had actually found out where we were taking the children and had booked an appointment and went in and spoke about my husband and myself. And so she said, I'm not willing to support you in court anymore. And we were really confused by that. But that felt like a real invasion of our privacy, and I feel like in hindsight, had I been stronger at the time, and I wasn't, I was hormonal, just had a baby, we'd had a massive trauma, I just couldn't put one more thing on my plate. But I do, in hindsight, think I should have reported that interaction. I think she really breached her duty of care to us, and her patient client privilege. So yeah, that was probably the worst experience I've ever had with counselling, and it did put me off for a little while. I found it really hard to trust a therapist again because of the kind of people we were dealing with. And everything else that was going on, I really did have myself convinced that, well, this person, if they could go to one therapist and convince them to discuss our family, then what's to stop it happening again? So I felt for a long time I couldn't trust, or I couldn't share with anyone. And so I had to really internalize everything. And I don't think that was healthy. I don't think it was very good for me. It wasn't the kind of situation that I could talk to with family or friends, or definitely work colleagues, because I really liked my job. So I just had to, kind of put on that brave face and pretend everything was okay, which didn't serve me well in the long run, because it gave everyone else the impression that I was doing a lot better than I was. But eventually I did find another counsellor who I just went to on my own, because I had a lot of processing to do. And I had to see someone because we had these, and I say these additional children, my stepdaughters, and we never, kind of separate that now. Like, we've all been together for 14 years full time. So, but at the time it was a lot, because we were trying really hard to support them. So then I had this extra concern that, am I now doing too much for them? Are now my children suffering? Are they going, well, mum's always focused on them, so she doesn't care about us anymore? And that was really difficult as well. And I had really complicated feelings, and they're not feelings that you can share with people because they're hard to articulate, and they can often be taken the wrong way, with people maybe thinking that you're saying you don't want them around, or that you get kind of that for want of a better term, that kind of evil stepmother kind of label, which nobody wants, and that's not the case. But in our case, it was more that my own children were going, well, you're always with them, you're always doing these things, like, where do we sit? And so then you'd swing back the other way. And so it took a little while to kind of find that balance, and it was with the counselling that I was able to do that, and to realise that my feelings were actually valid, and that it was okay to have time with both separately and then all together, and that, you know, everyone's life's so different. It's not linear. Like, we never know what's going to happen, and we just have to kind of adapt and do the best we can with what we've got, and try not to judge other people on face value, because you don't really know what's happening behind the scenes. And most of us, we do try and put on the best face we can for other people, to not make other people uncomfortable. So yeah, I think just trial and error until you find someone that you really mesh well with. And then I ended up with my psychiatrist, who I found, and although he's not a counsellor, we've developed a really, really good rapport, and I talk to him about most things now. And he challenges me, which is really good, in a very professional way. Like, I always leave feeling better than when I got there. So he's never dismissive. He's always supportive. He's always like, yep, we can look at that. What do you want to talk about? And I really like the way he works with me.
Yeah, those pieces are so important, that ability to feel validated in the session, because as soon as there's a question there for us, right, building that trust is almost impossible. Once we get that sense that, okay, maybe there isn't an understanding from this person about our situation, right? Because a lot of times, and what a great example, because so many times we're going in and we're already judging ourselves. And we're already worried about sharing with other people, because we feel that other people may judge us the same way that we're judging ourselves. And so being able to have that acceptance and that clarity, and somebody to be able to objectively and clearly say things like, yeah, it is okay that this is hard. It is hard. And so expressing that it's hard, it doesn't mean all of these other things. These are not black and white situations. So spending time with our stepchildren does not mean I don't love my children. And after 14 years of being together as a family, now looking back on that situation, I'm assuming it kind of feels like, yeah, that was a time frame of our lives, right? Where these two children needed so much attention, and this new baby needed so much attention. And I'm sure there have been other times when your children needed so much attention, right? So it just ebbs and flows in a family. But since it was the very beginning of that family unit, I can absolutely see where it might feel like, oh my goodness, is this going to be forever, right? Or where your children might have thought, is this the new family dynamic now, right? Or is this just what's happening right now? And in 14 years, we're going to look back and go, well, yeah, that is exactly what was happening right then. Right? And now we know there's a balance to this. Yeah.
Yeah, definitely. And it does, when you're in the middle of it, it feels like forever. And they're all grown-ups now. Like, they're all on that beautiful verge of 18 as an adult in Australia, so they get all of those rights as an 18-year-old, and they're all off at uni and, I mean, doing amazing things. So I guess we must have done a few things right, so that's good. But I've spoke to them more openly as they've gotten older, and, you know, always age appropriately. And I've said to my 19-year-old daughter the other day, I just said, you know, I always tried. I didn't always get it right, because I feel like it's really important for parents to recognise when they make mistakes as well, because I think that helps shape the way your children accept other people and apologise and are able to process things themselves, where they see, okay, mum and dad, they're not invincible, they're not infallible, they're just people like us. And I want my children to have that realization much younger than I had it about my parents, because I think I was like mid-30s before I went, what? My parents aren't perfect in every way? What's going on? But yeah, it's difficult. And I think even in a normal nuclear family, I'll call it a normal nuclear family, we tend to give more time to one child than another at different periods of their lives as they need it. But we don't question that, because that's the family we've created. It's when that dynamic shifts, and it shifts suddenly, that you start to question it. So had I birthed or adopted all of those children from babies, there would never have been a question in my mind, hey, am I spending too much time with this particular person, and is this person getting upset? I would never have questioned that. But because of the way it unfolded for us, I was always second guessing, am I doing this right? Am I doing enough? What else should I be doing? And we've actually done all kinds of therapy. Like we've sent children to art therapy and equine therapy, and whatever they needed in that moment, we went, where can we go and what's going to work best for each individual personality? Because some of them are talkers and some of them aren't. So we all needed different care models.
I love that. So if you could give one suggestion to somebody who maybe had not such a great counseling experience and is going, how can I trust another person, or how can I go through that again? What suggestion might you give them?
Don't give up. There is someone out there for everyone. So just keep going, and don't be scared to walk away. If you don't have to keep going back to that same person, if you don't feel that you have that right connection, walk away, find someone else, because eventually you will come across the perfect person for you, and you'll have that rapport, and it will only benefit you. But staying with someone too long is just as bad as not reaching out to someone in the first place.
Absolutely. Well, thank you so much for joining us. I feel like we could have kept talking to you for like another hour. So this is great information.
Has it been an hour already?
Yeah, I know. It went by so fast. If you are listening and you want some more information about Hush Hormones, their website is www.hushhormones.com, or they are also on Instagram and Facebook at Hush Hormones.
I am Margo Priestly, and I need a counsellor.
And I'm Chrissa Hunt.
And I'm Julie Johnson, and we need a counselor.
And so do you.
Bye.
Thank you for listening to the You Need a Counselor podcast. We are so grateful that you're here. You can also find and connect with You Need a Counselor on Facebook and Instagram. If you've enjoyed today's show, please take a moment to like, review, or leave a comment, as all of these things help others to find and benefit from the podcast as well. If you're in the state of Iowa and interested in mental health counseling or behavioral health intervention services, give us a call at 800-531-4236.